Hello friends. So what is hernia? Lot of the times we go to our doctors and in our reports or after examining us, the doctors tell us that you have a hernia. So what exactly a hernia entails? If you look at this picture, so there is a man and we can see that there is some swelling over his abdominal wall, the wall of his tummy, and you can see that some structure is arising from inside. Now we will focus on this area. So if you can see, so there is some swelling over the skin and inside some part of the intestine is coming out. So how exactly it looks? So this is a diagram in which you can see different parts of the abdominal wall. So there are multiple layers in our abdominal wall. The outermost layer is the skin that we see, our skin. Below the skin we have a pad of fat. Okay, this is the subcutaneous fat. After that we have the muscular layer. The muscles are present, and then there is the inner wall of our abdomen, which is known as the peritoneum. Now if there is a gap between the muscles, so because of the loss of strength, whenever we cough or do any strenuous activity, because of the increased abdominal pressure, the contents start to come out. They can be multiple organs, they can be the intestines, they can be the fat present inside the abdomen. All that can come out, and whatever is coming out is known as the hernia. So hernia can occur at different places. It is generally common in patients who have increased abdominal pressure. So patients who are routinely coughing, whether they might be COPD patients or TB patients, or patients who are always constipated or have some urinary issues and they have to strain to pass stools or urine. Those patients, as well as pregnant females who have increased abdominal pressure because of the baby, all these patients are at risk to have hernias. Hernias can occur at multiple places in the body. These are some of the common places where hernias occur. They can also occur after surgeries at the incision site, wherever we had cut the abdomen, because wherever we put a cut during surgery, the area becomes weak as compared to the natural area. So that is why we take care to close the area properly, so that future risk of hernia is very low. And how do we repair these hernias? So basically the concept is whatever is inside is coming out. So in a surgery for repair of hernia, we put all that content back inside the abdomen. We close the hole in the muscles with sutures, and because the muscle is very weak, we are only supporting it by sutures. So to strengthen the area, to impart additional strength, we put in a mesh. So this is a commonly used polypropylene mesh. There are multiple types of meshes and materials that can be used. This is a very common one that is generally used all over the world. So we have already put a cut over the patient and muscle repair has already been done. Now the surgeon is putting in the mesh, will fix it and impart additional strength to the area, so that there is no future risk of hernia. Similarly, as open surgery is present, nowadays laparoscopic hernia repairs are done. In that you can see that these are two laparoscopic instruments. With the help of those instruments, the hernia contents have been put into the abdomen again, and beautifully a mesh is placed in the area where the defect was present. Now after fixing this mesh, they will close the inner skin, which is known as the peritoneum. So this will be closed over the mesh, so that no internal structures or organs get in contact with the mesh or get stuck to the mesh. There are different areas of the abdominal wall where you can place the mesh, but these two are the most commonly used ones nowadays, and which impart the best results, so that there is no future hernia or there is no mesh migration. The mesh does not slip or go away to another area due to our body movements. So these two types of mesh repair are the best ones. We will not go into the technicalities. The simple thing to remember is that if a patient comes that I have a recurrent swelling over the abdomen, it comes whenever I do heavy work and it vanishes off when I sleep or lie down, and nowadays it is not even going inside So don't worry, it is not any kind of tumor or a cancer. It is just a hernia and requires a simple surgery to get rid of it. Thank you.